At a pre-mini budget briefing, Mmusi Maimane, leader of the DA in Parliament, told the press a national health insurance would not be sustainable with the current low tax base South Africa has at the moment.
In fact, the financing of NHI will depend on a broadening tax base. Now, South Africa, in a low unemployment environment, in a world where in fact less and less people are becoming taxpayers, just by virtue of not being able to find work, etc., etc., it renders the scheme unaffordable. So it's going to be a challenge for South Africa to be able to roll out this objective of national health insurance in the absence of a broadening tax base. Our view is that you've got to be able to get South Africans working, increase your employment levels, allow for South Africans to be able to have the choice to exercise their right as to which hospital they choose to go to, and then more vitally, be able to improve the current health system that we've got at the moment by improving not only access, but the quality of the healthcare you get in the hospital. So that's a key issue. There's no question about the fact that even if you look at our fiscal policy, health certainly consumes a very significant proportion of that. That's a very important.
What's very important is the price that you have to pay for money that you borrow. Because as we can see, the debt to GDP ratio is increasing very rapidly. There isn't space in our economy for us to borrow more money. And I think we must be very cautious of borrowing more money at a rate that's going to put pressure on. Because what happens is, obviously, if you're going to have to pay the debt back, you've got to sell rand to buy the currency to pay it off, which then creates a one-way bet on the rand. And that actually ends up depreciating your currency. And that's not a wise thing to be doing either.